Hello, this work is entitled The Safety of Complementary Therapies in Reducing Adverse Effects of Oncological Treatment. My name is Tyffane Andrade Dristig and I will be representing this research. Head and neck tumors are among the top 5 types of cancer globally, and its treatment often involves multidisciplinary approaches, including conventional therapies such as chemotherapy and radiotherapy, and complementary therapies. This study discussed the safety of 3 complementary therapies, the dexamethasone, low-level laser therapy, and ozone therapy, in reducing the adverse effects of oncological treatments. The effectiveness of these therapies is due to the modulation of redox signaling pathways for therapies that induce oxidative stress, modulating inflammatory process, and inducing cellular destruction in some pathogenic cells. The ozone therapy, which uses ozone to treat various medical and dental conditions, has anti-inflammatory, analgesic, and disinfecting properties. Low-level laser therapy, also known as photobiomodulation, uses low-power laser light to stimulate ATP production and accelerate tissue repair. The dexamethasone is a corticosteroid that reduces inflammation and inhibits cell proliferation in some types of cancer. The objective of this study was to evaluate the safety and effectiveness of these therapies, specifically in the treatment of adverse effects of oncological treatment of head and neck cancer. I mean to improve patients' quality of life without compromising the effectiveness of oncotherapy. So 856 initial studies were reviewed, of which 206 were selected for detailed analysis. The studies were selected based on pre-established inclusion and exclusion criteria. In the end, the study evaluated 167 articles. Based on the selected articles, this table was created with the results, which demonstrate that the therapy with the greatest number of articles published related to this research was laser therapy. The therapy that showed positive results regarding the direct use on neoplastic cells was laser therapy in the form of photodynamic therapy. Other therapies obtain inconclusive or insufficient results to confirm the safety in direct use on head and neck neoplastic cells. Low-level laser therapy is capable of reducing tissue inflammation by modulating pro-inflammatory cytokines and also stimulate collagen synthesis essential for the tissue healing and regeneration. It also has analgesic properties and improves local blood circulation. However, there is a possibility of stimulating the proliferation of cancer cells in some cases. The photodynamic therapy use low-power laser light and also a photosensitizer. The photosensitizer, when activated, induces photochemical reactions with the local oxygen, generating cytotoxic oxygen species and also free radicals, causing tissue damage like apoptosis and necrosis restricted to the tumor area. This therapy showed potential effectiveness in the treatment of early lesions, potential malignant lesions, and malignant tumors, and its use can be recommended based on each clinical case. It has fewer side effects than some conventional oncological treatments and can be used in conjunction with other oncological therapies, as it has a synergistic strategy when combined with other treatments. The dexamethasone is a corticosteroid that reduces inflammation and inhibits cell proliferation in some types of cancer through the modulation of genetic expression, suppression of the immunological and inflammatory response, and inhibition of synthesis of metalloproteinases, prostaglandins, and leukotrienes. Its use can minimize the side effects of chemotherapy and radiotherapy, such as nausea and edema. However, its use in patients with head and neck cancer is uncertain. The risks and benefits of systemic use must be assessed. 4 of 9 articles about this therapy do not recommend its use, and 3 were inconclusive, which shows that more studies are needed about this therapy. Therefore, Caution is recommended when considering dexamethasone in treatment protocols. Ozone therapy has strong scientific regardings in antiseptic and disinfectant properties. Ozone therapy also has effects on bone and soft tissue regeneration, for example, increasing bone area and osteoblast count, and also have inflammatory modulation and activation of immune defense pathways. Regarding its use in head and neck cancer, ozone therapy has potential effects as an adjuvant treatment and oncological treatment. However, due to the limited results found in this research, comprehensive evaluation and continued research into this therapy is necessary. Caution is recommended when considering ozone in oncology treatment protocols. In summary, those therapies can bring significant benefits in reducing the adverse effects of oncological treatments. Their safety and effectiveness must be carefully evaluated considering the therapeutic context and the patient profile. Additionally, more research is needed to fully understand the effect of these therapies in cancer patients. In this QR code are my references. And thank you very much.